This recording will go over Alzheimer's disease as well as the end of the PowerPoint questions for Chapter 20. So Alzheimer's disease is an incurable dementia illness characterized by chronic, progressive, neurodegenerative conditions with marked cognitive dysfunction. Onset usually occurs between 45 to 65 years of age. Many physiologic changes contribute to Alzheimer's disease and include cholinergic neuron degeneration and acetylcholine deficiency. So whereas Parkinson's is a deficiency of dopamine, Alzheimer's is a disease that has a deficiency of acetylcholine. Neuritic plaques and neurofibrillary tangles are associated with Alzheimer's disease. Symptoms of Alzheimer's disease include memory loss, confusion, inability to communicate, aggressive behavior, depression, psychosis. Progression leads to loss of memory, logical thinking, and judgment. Time disorientation, personality changes, hyperactivity, a tendency to wander, inability to express oneself, and later hostility and paranoia. There is no known cure for Alzheimer's disease, but there are medications that help slow the process and increase cognitive function for patients with Alzheimer's disease. One classification of medications used to treat Alzheimer's disease are the acetylcholinesterase inhibitors. So if you go back to what's the problem with Alzheimer's, and the problem with Alzheimer's is low acetylcholine. So an acetylcholinesterase inhibitor, you see that ASE, you know that we're talking about an enzyme. So acetylcholinesterase breaks down acetylcholine. If the medication is an inhibitor of that enzyme, it prevents the enzyme acetylcholinesterase from breaking down acetylcholine, which allows more acetylcholine in neuron receptors. It also works by allowing more acetylcholine to be present. It increases cognitive function and slows disease process. Your prototype acetylcholinesterase inhibitor is rivastigmine. So I'm going to let you look at those side effects on your own for rivastigmine. Your prototype drug for rivastigmine is on page 264. If you go on the next page, when you're done reviewing that prototype chart on page 265, again, the prototype acetylcholinesterase inhibitor you need to know is rivastigmine, but I also want you to recognize some of the more commonly used acetylcholinesterase inhibitors that include donepezil, brand name Aricept, and also memantine, brand name Namenda. Please pause the video and review the purple nursing process box that goes over drug treatment for Alzheimer's disease, and then resume the video when you've pulled out what you believe is important information. So under assessment, we want to assess the patient's mental and physical capabilities, noting any limitation of cognitive function or self-care. We want to get a history, a medical history, as well as a medication history, and also ask about any liver or renal disease or dysfunction. We want to ask about signs and symptoms associated with Alzheimer's. You can review those again on your own. And sometimes we need to ask family members if the patient isn't a good historian. Nursing diagnoses or problems that we're going to see in these patients are self-care deficits. So they have problems with feeding, bathing, toileting, confusion, obviously, coping. Injury is a big one. They have issues with wandering and not understanding what's safe behavior. In terms of planning, what's our goal with rivastigmine is that the patient's memory can improve. Again, there is no cure for Alzheimer's, but we hope to improve cognitive function and slow the progression of the disease. In regards to nursing interventions, we want to maintain consistency in care with patients who have problems with dementia or Alzheimer's. We want to assist with ambulation and activity to help promote safety. We want to monitor for side effects. We want to monitor vital signs, noting any bradycardia and hypotension. Observe any patient behavioral changes and note any improvement or decline. In terms of patient teaching, we want to make sure the family and the patient understand the purpose of the prescribed drug regimen and that they know the schedule for taking the medication. We want to teach family members about safety measures, such as removing obstacles in the patient's path to avoid injury when the patient wanders. We want to let them know about any support groups. In terms of side effects, inform patients and family members that the patient should rise slowly to avoid dizziness and loss of balance. We also want to monitor routine liver function tests because hepatotoxicity is an adverse effect. I want you to go ahead and pause the video to read the questions and the answer options, and then pick out your correct answer and resume the video to see if you're correct. So for question number 1, the correct answer is C. The cause of Alzheimer's disease is unknown. For question number 2, the correct answer is A. Food decreases the absorption rate of rivastigmine, so it is best to be administered without food. For question number 3, the correct answer is A. A statement from the patient such as, "I know I need to take this drug once a day," indicates that more teaching is needed because carbidopa-levodopa has a short half-life and must be taken 3 or 4 times per day. The other answers are true. For question 4, the correct answer is C. It is most important for the nurse to monitor the patient taking carbidopa-levodopa for agranulocytosis, which is decreased white blood cells, which is life-threatening. The other are not life-threatening. The correct answer for number 5 is D, glaucoma. Contraindications to therapy include narrow-angle glaucoma, severe cardiac, renal, hepatic disease, and suspicious skin lesions. For question 6, the correct answer is D. Because of the side effects of levodopa and the fact that so much levodopa is metabolized before reaching the brain, an alternative drug, carbidopa, was developed to inhibit the enzyme dopa decarboxylase. By inhibiting the enzyme in the peripheral nervous system, levodopa reaches the brain. The carbidopa is combined with levodopa in the ratio of 1 part carbidopa to 10 parts levodopa. And finally, the correct answer to question number 7 is C. Rivastigmine tends to slow the disease process. There is no known cure for Alzheimer's disease.